Hi, my name is Sonia. I'm a registered nurse in Yakima, Washington, and I'm here today in the cafeteria at Sela Middle School to discuss with you the importance of federal nutrition policies in the prevention and control of childhood obesity. Over the past several decades, childhood obesity has become recognized as a national epidemic. Since the 1980s, the incidence of childhood obesity has more than tripled. 30% of our nation's youth are now considered overweight or obese, putting them at risk for a lifetime of health and social problems, including poor academic performance, lower wages, and reduced self-esteem. Studies indicate that 50% of obese school-age children will become obese as adults. This raises their risk of developing serious medical conditions as adults, including type 2 diabetes and coronary heart disease. Childhood obesity also has a significant financial impact on our country, as it is responsible for over $14 billion in healthcare spending each year. In order to combat the threat of childhood obesity, we must be prepared to take action on a political level. One of the ways we can do this is by supporting stringent nutrition policies for public schools across America. Children spend a majority of their waking hours at school at least 9 months out of the year. In fact, 35% of a child's daily energy intake occurs while at school. In 2010, the Healthy, Hunger-Free Kids Act, which outlined nutrition standards for all meals sold in school, was passed by Congress in an effort to enhance childhood nutrition. Section 208 of this act required the United States Department of Agriculture to set forth nutrition standards for all competitive foods sold in schools. This includes foods sold a la carte and in vending machines. In June of 2013, the USDA proposed an interim final rule entitled National Nutrition Standards for All Foods Sold in School, as required by the Healthy, Hunger-Free Kids Act, to address this need. The interim final rule is in alignment with the Institute of Medicine's Dietary Recommendations for Children and the Dietary Guidelines for Americans. The interim final rule, which was put into action on July 1, 2014, outlines specific nutrient requirements and caloric limits for all competitive foods sold in schools. Preliminary research suggests that these policies have a significant positive impact on childhood nutrition and weight. However, schools still have the choice to opt out of the National School Lunch Program in order to avoid compliance with the competitive foods rule. Some schools are choosing to do this because of difficulty implementing the new rule and loss of revenue that comes along with it. The promising preliminary research indicates that this rule, once finalized, can have a significant impact on our childhood obesity epidemic. I implore you to support the enforcement of this rule nationwide with only minor adjustments to the final rule. By providing financial incentives for those schools that comply with the rule and technical assistance in its implementation, we can ensure that this policy has a significant impact on our childhood obesity epidemic. Thank you.